in the shoes of a Darzi fellow wanting to change the world. Another year, another Darzi cohort, lively and thoughtful as always, but this year was different. This year we were going to be working together throughout the year, supporting the Darzi Fellows to use the Who's Shoes co-production approach in their projects. We came together a week later for our Train the Facilitator session. These were the Darzis who were potentially interested in using Who's Shoes. Would Who's Shoes be right for them and right for their projects? How to make it happen and get the best results. They were a great group as always, and we had a really action-packed, thought-provoking session. We reminded ourselves about the power of storytelling and networks. Finding out what drives us personally, tapping into our own passions. We did some fun exercises to think things through and select the best projects to use as examples during this session. Who would win the last brownie? My daughter had made them, they looked delicious. Would we be prepared to share? Lots of thoughtful discussions about how to have conversations about service improvements with people who are underrepresented. Thinking through some of the key aspects of running a co-production workshop. Key principles: working collaboratively across boundaries to push the boundaries, and to think imaginatively about how to capture all the feedback and the key messages from our co-production initiatives. We were fortunate to have the skills of Anna Gaia from New Possibilities. Anna recorded the key points from the conversations, so many great ideas for people to be able to refer back to later. What were the elephants in the room? What were people worried about? How would this work for the Darzis in their time-limited projects? We talked through people's concerns, and I shared how these were very much in keeping with those of people who usually run Who's Shoes events. Being confident to invite people who've had negative experiences. This is how you will learn, and people will feel that you are listening. And how to preempt or overcome your own concerns or those of the senior leadership team. We did various exercises to get the Darzis thinking about the practicalities and how the approach could work best for them. The Darzis were reassured that there was plenty of support available, not least from each other. We set out to inspire them with some stories of what the Who's Shoes co-production approach has already achieved. Approval to build a Level 3 neonatal intensive care unit in Liverpool has to be right up there as one of the biggest outcomes. Anna, the graphic artist, made a great comment. She's been part of many Who's Shoes events with very different audiences and around very different subjects. Trust the process, she said, but put in the hard work and don't try to rush things. Every event is different. The Darzis had lots of ideas about how to add a bit of magic. I was delighted when Fran Rawling stepped forward to be the Who's Shoes champion, acting a bit of a go-between between me and the help that I could give and the Darzis and what they needed. Fran had impressed me as being very thoughtful and discerning. She was clearly going to take this seriously. After our session, I could feel the energy. Fran had set up a WhatsApp group for the Darzis who were interested, and we were able to explore things further together. It was good to see small groups coming together to explore the resources and think how they might use them. There were lots of creative ideas. The people who were particularly interested in working with Who's Shoes had a very diverse range of projects, but it seemed that many organisations were at a very early stage in their co-production journey, so exploring patient experience generally was a very valid aim, rather than necessarily needing bespoke resources for their particular project. I loved how Sonia dived in and held the first Two Shoes event, and the other Darzis jumped in to support her. It was good to see the energy starting to spark on Twitter too. But I want to use the workshop that Fran held in Guildford and Waverley as a little case study to demonstrate the power and potential of our collaboration. Fran and I worked closely together to sell the concept in a trust that had not previously used Two Shoes. And in a topic, frailty and the last 1,000 days of someone's life, that was very close to my heart, and an ambition I'd long held to run Whose Shoes events as a legacy to my much-loved mum and the learning from my experiences as a family carer. Fran kindly shared the slides that she used to persuade the powers that be in her organisation to support her. Here are 3 of them with some comments from her speaker notes. This is an opportunity for citizens and staff to find time to stop, step back from the day job, listen, reflect and take action, Fran said. The NHS is great at putting us back together when we need it. It's not so good at giving us a good life when we have conditions that aren't a one-off. There are some problems that money can't solve. A recent complaint to our hospital said, whilst it's clear that individuals may be working very hard and that the system is firefighting, it's even clearer that the system is broken in a way which additional funds would not address. Fran continued, this powerful message says to me, this is about culture change. We need to think about different ways in which we can respond to these types of complaints. I often hear people say, I can't fault the medical care that I received from the NHS, but the overall experience was poor. Fran went on to give some powerful examples, which themselves could be Whose Shoes scenarios for the future. Fran said she wanted to use the Whose Shoes toolkit to engage a diverse audience, including complainants, to trigger conversations around real issues older people face in the last 1,000 days of their life, identifying what needs to change, why it matters, and how best this can happen. Fran was very clear about the key objectives and worked hard to get the right people in the room, patients and family carers, talking to hospital staff and managers as equals. This was the buzz in the room before the event even got started. It was a workshop around frailty, but they found that the generic patient experience scenarios I'd supplied to the Darzi Fellows sparked the conversations they needed without needing any bespoke resources. And I got the designer to work on a few extra poems, as the poems always seem to resonate with people particularly strongly. Well done to Fran's sponsoring organisation for funding the graphic illustrator to capture the conversations live. It makes a big difference on the day and also provides a lasting record to help drive through the quality improvements identified. It was good to see people picking up on true co-production and the key themes that we find really make a difference to people. As Michelle says in her tweet here, seeing the person and not just a label or a medical condition. Anna's graphics were very memorable, as always, providing some iconic images about people sometimes feeling that they're being passed from pillar to post, the danger of isolation and feeling abandoned after leaving hospital, and more imaginative solutions around use of volunteers and social prescribing.
And then I wondered, so I put isolation over here, and I think it ended up over here because I was thinking it feels like in terms of designing services in the future that part and parcel of that has to be thinking about once people are discharged from your services in order to support them not to come back into services quickly, that thinking about that thing around people being isolated and feeling unsupported when they're discharged from hospital feels like it's crucial in that future service design.
I was delighted to see that Fran and the team in Surrey had really got Whose Shoes, and this example demonstrates this. One of the citizens who attended was living with dementia. He stood up at the end of the workshop and explained that he used to be a public speaker and now he was finding it hard to live this life. He wanted to talk about his experience of living with dementia and trying to articulate what he wanted during NHS appointments. As he shared his story, he struggled to get his words out, but he found everyone very supportive. There was spontaneous applause as he finished speaking. This event allowed him to get up and speak and was a very moving light bulb moment for the healthcare professionals about how to communicate with people and, as Michelle said, think about the person behind the dementia. Pledges are always an important part of Whose Shoes. As Fran said in her pitch to her sponsors, it's all about action. So it's difficult to kind of put a finger on exactly what happens at Whose Shoes event, but passion, personal responsibility, we try and encourage people to make pledges, but only if they're from the heart, if they're real. And these pledges were starting to come through on Twitter. So James and Michelle, two senior managers in the organisation, were pledging to use the learning from the day to build it into everything they were doing, really. We will transform integrated health and care. We'll use everything we've discovered today to inform how we improve services for people living in Guildford and Waverley. And again, people in the room being inspired to make pledges. So someone here, and I'm delighted to hear that this is actually happening, some of the early outcomes that they're reporting from Guildford and Waverley, working with the hospital to transform the menu to make it have a carbohydrate count to help people who are living with diabetes know what they're eating rather than just having to guess and hope that it fits in with their programme. It always warms my heart to see people pledging to get rid of jargon. It's one of the most obvious and easily removable barriers to good communication. The leadership team in Surrey Heartlands were really coming on fire with the aims and the outcomes of the workshop. We got a nice mention in the Surrey Heartlands newsletter, a vast partnership of health and care organisations across the county. The momentum and energy was building, with hospital leaders talking about how they could keep the new communication channels open and take appropriate next steps. It's always rewarding when the ripples start to reach people who weren't in the room. In this case, Debbie, from Surrey Together for Carers and Families, told Fran about social prescribing for carers and specifically the Surrey Carers prescription. Immediate practical support to someone who'd made a pledge to help family carers. A big part of Whose Shoes is around matching people who are crying out for help with readily available and often local services and support. Reflecting on the success of the workshop, people started to see the impact of coming together as equals. No hierarchy, just people. The pandemic was looming. The feedback about how isolated and forgotten people could feel after being discharged from hospital would prove prescient in the context of COVID-19, and it's been good to see continuing work to address this. Inevitably, the pandemic has got in the way a bit, but the ripples are still continuing, not least connecting people and ideas through social media and through the new Whose Shoes virtual events, which have drawn in Surrey Heartlands people as key contributors. This story could be a presentation all by itself. In fact, it kind of was, at the NPJ Paralysis Global Health Summit in July 2020, and through the new virtual Whose Shoes series, where these connections originally made at Fran's workshop have become much stronger and more fruitful. Like all the best projects, this collaboration has felt like a real win-win. A very simple example, Fran's careful research identified references to Who's Shoes that we didn't even know existed, like this one in the Point of Care Foundation. It was useful to see the Who's Shoes process through fresh eyes, as I supported Fran through planning, delivering and following up her workshop. It looks as though this experience has been significant to Fran as she moves forward and builds her career. It makes me smile thinking of her having her own copy of the poster from her workshop to inspire her in the future. She now has a new job, so this new thinking is already spreading further. Here is a bit of informal feedback that I hope Fran won't mind me sharing, as it's very significant in building on this collaboration in the future and getting the most out of it. I felt Who's Shoes had an amazing impact on the organisation, but this was hard to prove. The atmosphere was amazing and all the staff were so excited. If I started again, I'd be more on it with how to evaluate each stage. The Director of Transformation shook my hand and said it was the best patient experience event I've ever been to in my entire career. It's been exciting. It feels as though it was a big success. If the sponsor buys into the approach, then even if the Darzi leaves at the end of the project, as Fran did, there's someone to carry on the co-production momentum and embed it. Fran gave Michelle a list of contacts and actions. She says that Michelle is the living, breathing legacy. There are a few more ideas here that you might like to consider, particularly whether it's possible to invite interested sponsors to the original Who's Shoes co-production session so that they understand the opportunity which is available and save precious time during the academic year in terms of the Darzis getting going with their sessions. As you know, we've been busy developing a virtual Who's Shoes offer. This brings many new possibilities, so it'll be exciting to take this forward with you. Be very proud of your Darzi Fellows, but I know you are. Fran was a superstar. And thank you, Becky and London South Bank University, for making this happen.